Hey everyone, Dr. Reynolds, Urgent Care Management Monthly, and I think this is going to be awesome. Today I have with me one of my best employees, one of my best friends, a person who's been with me for a long time, Crissy Spearman. Hi, Crissy.
Hi.
How are you?
Good.
Are you nervous?
Yes.
Good. Excellent. Everybody's always nervous the first time they come on, so don't worry about that. So tell everybody, just for my sake, I kind of know, but how you got into workman's comp, what your background with Healthcare Express and me is.
I have been with Dr. Reynolds for 6 years and kind of fell into the workers' comp because we weren't really doing it, and when we started we needed somebody to learn the ins and outs. Yep. And I kind of took that on and recruited some companies, and here we are today.
Yep. And you've been with me longer than 6 years. You've been with me at Healthcare Express 6 years.
Yes, and then at the hospital a little bit longer.
We've been along together longer.
Yeah.
All right, so they've got a bunch of people out there. They've never done workman's comp before, or maybe some have, and they're trying to figure it out, okay? So think about, if you're an urgent care owner, should you add workman's comp as a piece of your urgent care or not? What are the advantages, disadvantages to it?
A lot of people are scared of workers' comp. Mm-hmm. They're afraid of the laws, the rules, a lot of hard work. It's confusing. In reality, if you just take the time and you learn the rules and the regulations, you'll be fine. Stick within them. As far as adding it, it's a huge advantage because, for one, workers' comp will never be an option with an employer. They will always have to have workers' comp. Two, it's low startup. You need a little bit of knowledge. There's not any necessary equipment that you need to purchase. You just need to get out there, recruit some companies, get their injured workers in, treat them, bill them, and collect your money.
Chances are, what we learned is you're already treating their workers.
Right.
You're just calling it urgent care, and if you treat those same people for their work injuries, you can add the workman's comp.
Exactly.
So it's just kind of what happened to us, right?
Mm-hmm.
Okay,
yes.
Good. All right, so kind of explain, even take it more basic, what is workman's comp?
Workman's comp is basically a form of insurance that the employer carries on an employee if they get injured on the job.
Right.
If they get injured on the job, it covers their medical expenses, pay time off if they have to be put off work, and of course if there is a death, it pays for the death benefits for the family.
Right. So what people are most scared of, especially for doctors, is all this mounds of paperwork I'm going to have to do, and there is some paperwork. So what are there like rules and regulations that an urgent care has to know before they get started in that? Basically,
you're going to want to know the required work status forms. If your state requires a specific, for example, in Texas they require a DWC 73 work status form. You would need to fill that out after seeing the injured worker. But other than that, no. That's really all the paperwork for the doctor. Most of the paperwork will fall on your supporting staff.
Right, and I think that's really the key. I think most urgent care owners, particularly if they're doctors, the reason they're scared to get into it is because they're afraid, oh my gosh, there's all this paperwork, and what they don't realize is that is true, mm-hmm. and so you need to find someone who's an expert at that to help you, or train someone within your staff to become the expert at that. Because I can imagine if it was the doctor burdened with all that, it would not be worth doing at that point. So you've got to have somebody who has an interest in that who'll help you with that kind of thing. All right, so credentialing. Talk about workman's comp, credentialing, and how all that works.
Credentialing with your work comp insurance carriers is just as important as your private payers because they pay in and out of network. If you're not credentialed, they may not pay at all.
And I bet most people have no idea about that.
Right. You need to contact, once you set up a company, they will let you know who their carrier is. You would need to contact that insurance carrier, find out how you need to become part of their network. Each insurance company is going to do it a little differently. So they might want different information than another
Just
carrier.
Like the Blue Crosses and the Aetnas.
Just like your private payers, right.
So we have 200 or so companies. Mm-hmm. How many networks is that?
Probably about 5 or 6 in Texas.
So it's not 200 networks.
No.
It's 5 or 6 networks that most of the companies apply to and that they use.
Right.
Okay.
And in some of them, you're credentialed directly with the insurance carrier.
Okay. So now you're in the network. So, okay, let me ask you a question. This isn't on our list, but I know you know the answer. So somebody comes in and their workman's comp injury, that's a new company that here's where we do workman's comp, and we're not in their network yet. What happens to that?
Go ahead and treat them. You can offer them your cash pay discount prices if you want, until you can get the paperwork necessary.
Until you can get paperwork and network.
Can
you retro bill that?
That one I'm not sure about.
It's not hard to know if you can do that in some. So somebody comes in today and you treat them, you may not get paid if you bill the insurance, but you can do your cash pay and then get them in the network.
Right. Exactly.
Okay.
Exactly.
Okay. So somebody does come in. Now they're in our network. What do we need to verify when that patient checks in to make sure we get paid when they leave?
The most important thing when a patient comes in, especially a new workers' comp, is you're going to want to call the company and make sure they have permission to be there. Make sure you have permission to bill their insurance.
Not coming on their own.
Exactly. Make sure to see if they need a drug screen. There's many things that you need to call and verify. You can also set up a verification process with the company where they send in a piece of paper with an injured worker, and it gives you the necessary information you will need, such as do they need a drug screen, they already have authorization to be seen, so that saves a phone call. And
right. So, and I know, and you may not know this, different states, of course, have different rules.
Yes.
In some states, it's the patient's choice as to where they go. In some states, the company requires them to go a certain place. That happens mostly in our state.
Right.
And so those different rules, certainly in your own state, you need to look and see what those rules look like,
yes.
so you know how all that works. Okay. So are all workman's comp cases, once they get here, treated the same, or do you have different protocols for different companies, or how does that work?
We have different protocols. We keep those on file to where the doctors and the staff can get their hands on them very easily. Some companies require drug screens, some don't. Some want
So
red
a
dot,
protocol
some
basically says this is what our company would like to happen
yes.
to each employee.
When our employee comes in, this is what needs to happen.
Okay. I have a good friend who does a lot of workman's comp in Illinois, and their system is basically the opposite of ours. I mean, if it's employee driven, they can go wherever they want. They get in a lot of problems between the companies and the employees and those kinds of things. But the one, and then I have some friends in other states, the one thing I've noticed that we've been doing very well is to maintain a good relationship with the employer. How important has that been to us?
That is very important.
Yeah.
Very important.
I think that's been the key to our success.
Yes.
Yes, our job is to treat the injured worker and make sure we do the right medical thing for them, and to keep a good relationship with the employer. And walking that fine line is what is, yes. I think, the key to success. Okay.
Yes.
Talk about disability guidelines. How do urgent care centers get copies of those?
You can actually go on the official disability guideline website, and you can purchase an online copy, or they have a book that
so
you can purchase.
Just look it up, and it'll give you the guidelines.
Right. You find the injury, and then it'll help you with the guidelines of how to treat disability. Should they be put off? If they need to be put off, how many days?
Good.
Things like that.
So in addition to workman's comp, we offer what we call from beginning to end, right? Door
yes.
to getting the patient back to work. What other services could a urgent care offer to employers besides doing the workman's comp?
Drug screens.
Yeah.
Majority of your companies are going to require a post-accident drug screen, and if you offer that when they come in, then it's a one-stop shop. You can get everything
they don't have to get their drug screen over here and get their workman's comp.
Right. They can get everything they need right here with us.
Right. And we also do, just so this isn't part of our notes, we do their pre-employment physicals.
Yes.
So everything from before they're hired all the way through getting them back to work, we offer the entire gamut of services.
Yes.
That's not something we always did. It's something we've learned along the way, so that means anybody can learn it. And
right.
certainly we could help them with that. So customer service obviously is important. In workman comp injuries, how is that different from a regular customer service? Is there any differences in that?
Yes, you have two customers to keep happy.
Oh, we already started talking about
yeah,
this.
we did. You have your injured worker who you want to give the best medical care to. And then you have your employer who wants that employee back to work, who wants to keep their costs low. So it's a fine balance of keeping both of them happy, because you may have an injured worker who comes in who wants to be put off for 4 days.
Right.
But you know that that's not the best interest for your company.
Or for the employee.
Or for the employee, yes.
And I think what's really distinguished us from a lot of our competition is that balance that we just talked about.
Mm-hmm.
Because I found that if most people you talk to say, well, I hate it because the employee wants one thing, but the reality is what's best for the employee and what's best for the company is to get that person back to work as soon as possible. Mm-hmm. It's best for their identity, it's best for their self-esteem, it's best for their health, because we don't want them to get in that circle where they're working so hard not to go back to work that there becomes this big problem.
Yeah.
And I think if you can circumvent that right from the beginning and say, our job is to get you back to work. Mm-hmm. That's what we're going to do. We're going to do it as quickly as possible. And that's sort of the mentality going into
right.
it. I think it makes everybody happier in the long run.
Right.
Good. Any other things?